registered nurse Candace Sims is suing Sarita Moore for legal bills, lost wages, and defaming her character when Sarita accused her of abusing her mother.
Order. All rise. It's case number 182 on the calendar, the matter of Sims versus Moore.
Thank you.
You're welcome, Judge. Parties have been sworn in. You may be seated. Ma'am, have a seat.
Ms. Sims, the case is relatively simple. The facts might get a little more complicated. You allege that Miss Moore told lies about you, and those lies resulted in you losing your job as a nurse.
That's correct.
And you want her to pay you the court's maximum of $5,000 because you say she defamed you, and based upon that defamation, you lost your job. Miss Moore says she reported exactly what she saw. Whatever action was taken by the hospital where you worked, that's up to them. So I need some information from you. How old are you?
I'm 35.
Where did you go to nursing school?
I originally went to Victoria College in Victoria, Texas, and then I went to Texas Tech University.
In what year?
2001.
How long a course was that? How long were you in Victoria College?
It was a 2-year nursing degree program.
Did you stay the full 2 years?
It actually took me longer to complete. It took me about 3 years.
From 2001, when you graduated, until this incident, which happened in 2012, where were you working?
I had worked several places at the...
Well, let's start. Your first job was where and for whom?
It was at a community hospital called DTAR Hospital in Victoria, Texas.
And did you leave voluntarily from that place?
Yes, ma'am.
Where did you go from there?
I moved to Houston, Texas.
And where did you work when you got to Houston?
My initial job was at Memorial Hermann Hospital.
For how long?
I worked at that campus for about a year.
What happened to that job?
I got another job at the hospital in question.
What year?
That was 2007.
So from 2007 until 2012, you were working at the hospital where this incident took place?
Yes.
As a nurse?
Yes.
Now, Miss Moore, your mother was admitted to that hospital.
Yes, ma'am.
And what was she admitted for?
Seizures and hemiplegic migraines.
How long was she in the hospital?
6 days.
Now, when for the first time did you see Miss Sims?
On the 10th of April, 2012.
Is that when this incident took place?
Yes, ma'am.
What time?
This was around 9 o'clock in the morning.
Had you been at the hospital, or were you just arriving at the hospital to see your mother?
I was just arriving, ma'am.
Did she have a room by herself, or did she share a room?
She had a room by herself in the emergency room.
Tell me what happened when you walked in the door.
Okay, I had to open the door because the door was shut as well as the curtains were drawn. So I had to pull all of that back, and when I pulled the curtain back, she was straddling my mother, holding her down, pushing her neck to the side with a needle in her right hand, trying to stab her in her neck.
So what you saw was her up on the bed?
Yes, she was straddling my mother.
And you don't deny that? You acknowledge that that's what you were doing. You were trying to get blood.
I was not on the bed, so I do deny that.
Where were you?
I was at her left side on the floor. I was never in her bed.
Tell me what else you saw.
I saw her straddling my mother. She's correct, on her left side with the needle in her hand, saying she was going to get this blood. And I asked her to stop. She would not stop. At that point, I left out of the room. I grabbed the first nurse available, asked them to call security because she was attacking my mother, would not stop, and would not leave the room. And they called security. The police were called, and we made our report.
Do you have a report?
Yes, I do.
I'd like to take a look at it.
This is the initial report from the date of the incident, and I also have in the medical records where they documented that the complaint was made to the hospital as well.
Well, this doesn't contain a police report of what you described you saw.
Yes, Your Honor, that is because once we went to the police department to inquire about getting a report, they said that we were not able to have that report. That's why I left the number and contact name of the person that was there. That's all they would give us.
I'm not. What I'm going to ask you, Miss Sims, is I read your complaint. You say that you were trying to insert an IV.
Yes,
Is that
ma'am.
right? Where were you trying to insert the IV?
At the time when the defendant walked in, I was trying to insert the IV in her mother's left lower arm.
But this isn't the first attempt that you made to insert an IV. This was your fourth attempt
That's
to
right.
insert an IV. Where had you tried the first time?
The first time was on her right antecubital area, which is in the bend of the elbow.
And what happened that time?
It was unsuccessful.
Unsuccessful meaning what?
I couldn't thread the catheter. I didn't get any blood. I couldn't give any medications.
And where was the second time that you tried to draw blood?
The second time was in her right hand.
Over here.
Yes, ma'am.
Or you're trying to insert the catheter. It's not drawing blood, you're trying to insert the catheter.
I can draw blood from that also.
I know, you can once it's in,
Yes,
but
ma'am.
what you were trying to do is insert an IV.
That's correct.
And you were again unsuccessful.
That's correct.
And then there was a third time that you tried to insert an IV. And where was that?
I believe the third time was on her right forearm.
And that too was not successful.
That's correct.
And so that when the defendant came in, it was your fourth attempt
Yes, ma'am.
to insert an IV. At what point, Miss Sims, would you deem it prudent to call in a doctor to say, I'm having trouble inserting this IV. I've made now 4 attempts unsuccessfully, because each time you make an attempt, it hurts the patient.
That's correct.
Often there's a hematoma as a result of what the experience was. So you've been unsuccessful at your craft on a patient. So my question to you is, at what point do you ask for a more professional person to involve themselves in this IV process?
It depends on the patient.
You mean you just keep sticking her?
It depends on the patient and their veins, and if I feel like
there was nothing wrong with her veins, right? Eventually she had an IV put in.
She eventually had an IV.
Yes, and you didn't put it in.
I did not put it in.
Who put it in?
Another nurse.
And do you know how many tries it took her?
No, I don't, and I believe it was a male.
But somebody else managed to do it.
That's correct.
Now, I can't render any judgment because it's really beyond my expertise, so I can only give you my own personal view of if I were in a hospital and I had a nurse, she would get 2 tries. One may be, next time you try, you can't do it. I would say, out, get me somebody else. That's what I would do. And I don't know what the protocol is. I think most people would give you 2 shots, not 4. So I don't know whether you were up on the bed or on the side of the bed, but I think it was not prudent of you to stop after you couldn't do it at least 3 times. Anyway, she reported what she says she saw. And you left the job, right?
Ultimately, yes.
You left the job. Did you leave the job on your own volition?
Well,
you were upset about what happened. I read your complaint that day. You walked outside to cool off, and then what happened?
I went back inside and I told my charge nurse that I did not feel comfortable being at work anymore. Being at work that day because of the events that had took place. And I just told them I was ill and if I could go home, and they excused me.
Did you come back to work the next day?
No, I did not come back to work the
Why?
next day. I wasn't scheduled the next day, number one. But I did receive a phone call that had said they had made a complaint and that there would be an investigation.
Did they tell you you couldn't come back to work?
No, not at that time.
Why didn't you go to work?
Because the investigation, you're suspended without pay until it's completed.
Oh, do you have, just curious, you have a paper that says that you're suspended without pay?
It doesn't say suspended without pay, but it does have that I was suspended.
On what date?
It's marked April 18th through the 20th.
April 18th is a full week. This happened on April 10th.
I wasn't scheduled again to work till April 18th.
Oh, is that the reason that you didn't go to work? You was off for a whole week?
Yes, ma'am.
Okay. Are you the patient?
Yes, ma'am.
Do you remember what happened on April 10th?
Yes, ma'am, I do.
Come and stand up. Your last name is?
Grady.
Okay, April 10th. Were you alert?
I was in a lot of pain and I went to the emergency room.
But were you alert on April 10th when Miss Sims came in to try to insert an IV?
Yes, ma'am.
You want to tell me what happened?
I have hemiplegic migraines, and what that is a condition that gives you stroke-like symptoms. It can shut your whole left side down and take away your speech. On this particular day, my speech was gone. I could not talk. So when she came in and tried to insert the IVs, there was no way I could, say stop.
So she tried to insert an IV once.
Yes.
That didn't work.
No.
And she tried a second time?
Yes, ma'am.
Did she say anything to you when she tried the second time?
No, she didn't say anything. But the second time, when she didn't get it, I was trying to motion and use hand gestures for her to stop because I couldn't verbalize it. So I had to use my hands and try to cover my arm, but she wouldn't stop. She just